All right, so you're evaluating shockwave for your practice. Smart. But there's a question that matters more than anything else. Does the device you're looking at actually produce a true clinical shockwave? Because both radial and electrohydraulic get thrown under the same shockwave umbrella, but they generate energy in much different ways. And that difference determines how deep the wave travels, the biological responses it triggers, and what kind of clinical outcomes you can realistically expect. So let's break down the science behind both systems and walk through what the research says when they go head to head. First, let's define what a shockwave actually is. A true shockwave has 3 defining characteristics. Number 1, it's supersonic, meaning the wave travels faster than the speed of sound. Number 2, it has an extremely fast rise time. We're talking nanoseconds. That's what determines how fast the wave reaches peak pressure, which directly influences how powerful the biological effects are on the tissue. And last, it creates a very specific pressure pattern. There's a fast, powerful burst of energy followed by a brief pulling phase that stretches the cells in the opposite direction. These 3 characteristics matter because the biological responses that lead to regenerative healing at the cellular level are tied directly to whether these 3 thresholds are met. And as you'll soon see, not every system matches these criteria. Okay, so now that we've got that all cleared up, let's dive into radial. So radial devices use compressed air to fire a projectile inside the handpiece, and that projectile strikes an applicator tip, and that impact generates a pressure wave that radiates outward on the surface of the skin. Think of it like dropping a rock into a pond. The splash is biggest at the point of contact, and then the ripples spread outward and lose energy as they travel. The same concept applies here. The energy is highest at the surface, right where the applicator meets the skin, and it disperses as it moves further away from the area of contact. And according to published studies, radial pressure waves go about 2 to 5 centimeters deep. That depth is important to take note because the majority of chronic and acute conditions that your patients walk in with, they don't actually live in that range. Now, the other thing to understand about radial is the waveform itself. Because the wave is generated by a mechanical impact rather than an explosive event, it doesn't produce a true shock wave. Instead, it produces a pressure wave, and the rise time reflects that. So radial pressure waves take about 5 to 10 microseconds to form, and compare that to a true shock wave, which only takes 5 to 10 nanoseconds. It's about 1,000 times slower, which is a big reason why radial has now been declassified as a shockwave. So, what does this all mean for your patients? Well, it's been fully documented that radial pressure waves can absolutely reduce pain, improve local circulation, and help break up superficial adhesions. It's a very effective tool for those surface-level applications, which is one of the main reasons why it's used in veterinary clinics. But when it comes to those stubborn, chronic, and acute conditions like frozen shoulders and degenerated hip joints and deep knee pain, you might want to use something else, which now brings us to electrohydraulic, where the physics here are fundamentally different. So electrohydraulic doesn't use compressed air or a projectile. It uses a spark gap submerged in water. And in an instant, a spark ignites, superheating the water and creating a plasma bubble that expands and collapses in under 10 nanoseconds. And that event generates a true shock wave right at the point of origin. A reflector then focuses that wave toward a specific depth inside the tissue, and the energy arrives with peak intensity rather than dissipating at the surface, which is the opposite of radial. Because instead of energy dispersing outward and fading, electrohydraulic waves concentrate energy inward, reaching up to 10 to 12 centimeters into the tissue, which is 2 to 5 times deeper than radial. Now, the other key difference from radial is the waveform. Electrohydraulic systems generate a true shockwave at the source. The rise time is measured in nanoseconds, not microseconds. And when the wave reaches damaged tissue, 2 things happen. First, it pushes. A rapid burst of pressure compresses the cells, and then it pulls. The pressure drops and the tissue stretches in the opposite direction. And that push-pull is what triggers some of the most significant biological responses documented in the shockwave literature. And that process is called cavitation. And cavitation is directly linked to stem cell recruitment, new blood vessel formation, and the activation of tissue repair at the cellular level. And those effects are the key difference between temporary pain relief and actual regenerative healing. To trigger these regenerative responses, you need sufficient amounts of energy, delivered with clinical accuracy, and it needs to reach the exact depth where the injury lives. And electrohydraulic systems are engineered to meet all 3 of those requirements. So now that we have a better understanding of how these systems generate their energy, let's see what happens when you test them head-to-head with actual patients. A randomized controlled trial published in Biomed Research International, compared focused shockwave versus radial in 46 patients with rotator cuff tendinopathy. And midway through the study, the focused shockwave group had reduced their pain scores from 5.9 down to 2.7. The radial group went from 5.5 to 4.5. That's a meaningful reduction, but only half the improvement. And by the end of the study, the gap widened even further. The focused shockwave group was at a 1.4 out of 10 on the pain scale, and the radial group was at a 3.0. So basically, the focused shockwave group went from a 5.9 down to a 1 on the pain scale, seeing an 83% reduction in pain, while the radial group only saw a 45% reduction. And this again proves the clinical efficacy of radial. However, it also highlights the differences in clinical outcomes between the two systems. Now, a separate 2022 randomized study also looked specifically at knee osteoarthritis. At 4 weeks post-treatment, the radial group had gone down by 2.6 in pain. But the focused shockwave group, they had a 4.5 reduction in pain. That's nearly double the pain relief at only the 4-week mark. And when we bring this back to the day-to-day applications, it means better patient compliance, lower drop-offs, and the ability to offer significantly more relief to your patients who need it most. Now let's summarize everything we just talked about. Let's start with how both systems generate their energy. Radial uses air pressure to send energy into the surface, and electrohydraulic uses a spark gap plasma explosion that generates shockwaves at the source. Next is the effective treatment depth. Radial delivers therapeutic energy at approximately 2 to 5 centimeters deep, and electrohydraulic reaches up to 12 centimeters deep. Then we have the rise time. Radial operates in microseconds, which is roughly 1,000 times slower than the threshold for true shockwave formation. But on the other hand, electrohydraulic operates in nanoseconds, which is consistent with the window required to form a shockwave. Now, the regenerative effect. It's limited with radial due to insufficient energy and penetration depth, but it's fully documented in over 10,000 white papers using electrohydraulic systems. And lastly, clinical outcomes at long-term follow-up. Studies have shown that electrohydraulic systems can lead to up to 100% improvement in pain reduction when compared to radial. That's double the effects. And that difference in clinical outcomes directly impacts how well integrated the technology becomes in your practice, along with the demand for the service. But honestly, the simple way to think about all of this is pretty straightforward. If the pathology is shallow and you're primarily targeting surface level pain relief, radial can be a great tool. Again, this is one of the main reasons why it's used in veterinary clinics. But if the pathology is deep, chronic, or degenerative, and you need actual tissue regeneration, you might want something else. So that's the science behind both systems, and each one has a role in clinical care. And understanding what each system can and can't do is essential when you're making a decision for your practice, especially when your patients are counting on you to choose the right device for the conditions they're walking in with. So if you want to go deeper into the research on these devices, we'll link the key studies referenced in this video in the description below. We also have a full shockwave masterclass you can access below in the description, where we cover the 3 main systems used in today's clinical applications. And that's all for now, so thanks for watching.